remember going into the doctor's office, and I remember telling her when she asked about my sexual activity if if I use condoms or anything like that, and I said, no, I'm gay. And I just remember her face changed very much, and her warm tone of voice turned very harsh, and it seemed as though she was rushing me out.
I went for the pill because I had really bad period pains, and she went, "Is it for contraception?" And I was sat in the room with my girlfriend. I was like, "No, that's my girlfriend." She went, "Oh," and gave me like a really dirty, snotty look, and I was sort of like, "Oh," and then she was like, "Oh, I guess it's just for your period then," and I was like, "Well, yeah."
The whole thing in the back of your head is, are you being judged whilst you're there?
It's important to tell your doctor that you are gay, and if so, how do you go about doing that?
That was Chris. Another difficult question, Chris. It is important to let your doctor know that you're gay so that your doctor can have a better idea of what has an impact on your health. A big thing that can impact health has to do with sexual health. And I think it's important to let a doctor know to focus his or her attention on sexual health. But having said that, I don't know how different doctors react to that. Doctors tend to be a little bit conservative as a group, and so some doctors may be receptive and others may just sort of shut down. So I do think it's important, but that doesn't mean that the reception that people get out there in the world is necessarily going to be welcoming.
And if it's not welcoming, maybe it's a good time to find someone. Yeah.
I do think the LGBT community has special needs. I think the LGBT community has a specific special need, which is to be treated the way non-LGBT people have been treated forever, which is to be asked about their sexuality, to be asked about their quality of life, what their home situation is, what their work situation is, what their friend situation is, without the person asking the questions being afraid of what the answers might be.
My OBGYN has played maybe 10% of a role in my sexual health.
She said, oh, you don't really need to get tested for AIDS because you don't have sex with men and you're not a prostitute.
If you're straight or if you're a gay man, then yes, you've been told countless times that you need to have safe sex. But if you identify as a lesbian, a bisexual, or a queer woman, then you've probably noticed that your sexual health has been largely left out of the conversation. So what I'm wondering is, how can queer women get the sexual health care they deserve? Who might not identify as women. But for this video, we're talking about people with vaginas who are also sleeping with people with vaginas. Imagine it this way. You walk into a doctor's office, and before you even have said a word, they've already made assumptions about your sexuality, who you've slept with, or what you're at risk for.
The only questions they asked about sexual health were, are you using birth control or are you using condoms? So I would always say no and no. The nurses would look at me horrified and say, what are you doing then? And I would say, well, I'm a lesbian.
Medical students get almost no training in LGBTQ health.
I could see them get visibly uncomfortable and kind of clam up, and then it's like, well, now you're about to look into my vagina, and I feel deeply uncomfortable.
That discomfort, that lack of knowledge, these have serious health consequences. Maybe you never go back, or maybe the doctor doesn't give you the care you need.
The state of LGBTQ health remains tenuous.
You don't need a penis or semen to spread STIs. Queer women can pass them back and forth, like this. And that's just assuming that you and your partner and all of their partners have only slept with women. How did we get here?
People still have a really hard time even understanding what women do together.
Like, if there isn't a penis involved, it may not be really sex.
Think about it. Remember all of those safe sex campaigns we grew up with?
First, only gays and IV drug users were being killed by AIDS.
In fact, the person you're with right now might have HIV.
Yeah, that's a lot of straight people and gay men. So what does safe sex even look like for queer women?
So this is a dental dam.
People don't even know where to buy dental dams. Who the hell would want to use them anyway?
Hold it against your darling. Use the other side of it for yourself, for your mouth.
I mean, it's not something that I use all the time. It's something that I use when somebody's like, oh, hey, this is happening to me. Okay, cool.
So this is a finger cot. It will protect your finger.
Finger condoms are something that I recently discovered.
I don't think my OBGYN actually has ever said you could use dental dams or you could use gloves.
This information is just not as readily available as it needs to be. So what are some ways that queer women can make their appointments more relevant? Number 1, take a look at that.
The GP I went to after that she asked me if I was sexually active, and I said yeah. She didn't question whether it was a male or female partner or anything like that. Because I'm bisexual, I'm not.
I've also gone to doctors with a couple of STI worries, STD worries, should I say. And all the time it's come out clear, but it has always been like, at that time he's been a bit more sensitive with me because it is generally a sensitive subject.
Sometimes
So I'm Megan Coleman. I'm a nurse practitioner at Whitman Walker Health in Washington, D.C.
A list of questions that you generally, or you try to ask all of your patients. Tell me how that goes.
I do. So I understand feeling uncomfortable because I was very uncomfortable when I started, but just having this list of questions made it easier in my head, and asking everyone makes it easier, and there's no misconceptions by anybody. So I just start off telling every patient that walks in the door that I ask the same questions of everyone that comes in. If anything makes you uncomfortable, just let me know and I'll stop.
Is the stigma of having many sexual partners justified, or is it actually more harmful?
Well,
that's a loaded question.
That's a loaded question, and that's another challenging question. Certainly having more sexual partners can put a person at greater risk of STDs, but it depends who your sexual partners are.
Right. And then
where you meet them and what you do with them.
And does that justify the stigma?
I would say no, it doesn't justify stigma. I think stigma about most things in the world is not justified,
right,
because stigma is essentially just a form of bias and
shaming.
Yeah. It doesn't lead to any good. Having lots of sexual partners could be that's your sport and that's what you like to do. It could be a sign of desperate loneliness and looking for something that you can't really find, but I can't say. It's going to be different for every individual.